My name is Kevin Poe. I'm an internal medicine physician in Nashua, New Hampshire, and I'm the founder and editor of kevinmd.com, which is a blog known as social media's leading physician voice. Well, what I do is I tell stories. One of the major purposes of kevinmd.com is to share the stories of the many who intersect with our healthcare system but are rarely heard from. And these aren't the voices that you typically hear in major media. These are the voices of practicing physicians, patients, medical students, and nurses. And certainly I think using social media is a great way for the medical tourism industry to share their stories. Because a patient in the United States, they're not going to have a lot of experience as to what it's like to go overseas for a procedure. So by sharing these stories, using social media, I think it's a powerful way to gain some familiarity in this industry. Well, they asked me to speak about online reputation and social media because I've been doing this for 10 years now, and I have a book on establishing, managing, and protecting your online reputation, a social media guide for physicians and medical practices. And I think a lot of healthcare professionals, doctors, facilities, and hospitals, they're a little bit apprehensive about what their reputation is online because more and more patients, they're Googling their doctors, and they're just not quite sure how to navigate the online waters. So one of the ways that I try to show is to share my journey, share my experience, and give some tips to these medical providers on how they can establish and protect and manage their online reputation, whether it's through an online rating site or whether it's through various social media channels. And hopefully I gave some helpful information. Well, just looking at the agenda, I think that it really gives a global perspective of healthcare. Traditionally, I would just speak within the United States and meet doctors in the United States, but already in my first morning here, I've met doctors and representatives from hospitals from all over the world, and it's fascinating hearing their perspective as it relates to a lot of the same issues that we're dealing with here. So even though it's just been a few hours for me, I think that it's certainly been an educational experience. So this is my first time I'm attending here. I think for my initial impressions, again, that global perspective, and just really opening my eyes to medical tourism as a whole, because as a practicing physician, I have to admit that medical tourism isn't really an option for a lot of my patients, but certainly hearing some of the presentations here and reading some of their stories certainly is something that I may consider in the future. Well, they should care about social media because that's where their patients are going to be. Their patients are going online to research their health information, and they're not just going to websites, they're going to other social media platforms like Facebook, Twitter, and a blog. And if doctors aren't active on social media, patients are going to go to perhaps less reputable sites. So doctors need to care about their online presence. They need to care about the information that they're presenting out online, because if they don't produce reputable health information, patients are going to read information from less reliable sources. I think that patients can use social media to find stories, to find people who have things in common with them. I talked about how patients want to relate to others, and sometimes as a physician, I don't have a lot of the diseases that I see in the exam room. I don't take a lot of the medications that I prescribe. I've never had a lot of the studies that I order. So sometimes I can't relate on that patient level with the people I see in the exam room. So social media is a pretty powerful way for patients to find others who are going through the same journey that they have. And it's just tremendously powerful in terms of giving these patients that type of support. So I think, as you know, there are dozens of social media channels, and from a physician standpoint, I always say you have to use a social media platform that gives you the most energy. Is it connecting with patients on Facebook? Is it finding new colleagues on Twitter? Is it creating videos on YouTube? Or is it writing a blog post to talk about healthcare reform? And once you find that platform that gives you the most energy, you want to spend the time and cultivate that. So there's no simple answer to this question. There's no one right way. It really depends on what your goals are for social media and what gives you the most energy.